everyone, I'm Tara Pizzuto. I'm a doctor of nursing practice in neurology at AI DuPont Hospital for Children, otherwise known as Nemours. I am the director of the headache program, and I will be hosting your time for the next lecture on the newest migraine medications to come. My nurse, Sue Hershey, is wonderful, but unfortunately couldn't be here to do this recording for you today. She will be available for questions when we are live online a little bit later, but I'm going to present her PowerPoint on the Pediatric Migraine Action Plan, which is a contract between you, the school, and your provider in creating an environment in the school that's best suited for your child in order to succeed. So hopefully this will give you lots of information that you can share, and certainly I can provide you with a sample contract if requested a little later, okay? So the Pediatric Migraine Action Plan, or PEDMAP, is what we've been using for our patients. It was designed by several headache experts over several months, and then published in the Headache Journal of Face and Pain Journal, I believe last year. It's been a group effort to make it the most effective communicative tool between your provider and the school, as well as the parent. There are no disclosures per Sue. Her objectives were, why do we need a pediatric migraine action plan? So we'll talk a little bit about that. What is a pediatric migraine action plan? What is a PEDMAP used for? And who will the PEDMAP benefit? So we need a pediatric migraine action plan because headaches in children are on an incline. There are 1 in 11 children living with chronic headache or migraine. This is a pretty alarming statistic when compared to the other illnesses such as asthma, where there's 1 in 12 children living with asthma. So huge impact on our community, huge impact on our families, huge impact on our kids, and definitely something that needs to be addressed from a community perspective. What is a PEDMAP? The main goal of the PEDMAP is to provide a personalized plan of action to help children and adolescents who have migraine succeed in school. In order for that to happen, we look to outline a better plan for school hours, extra time, activities that can be conducted at home. Also, tool for school nurses to use as a guide to treat a student with migraine at the school. So it gives them the knowledge of what you're doing, what the child should be doing, what the school should be doing, when and how to respond, all of those key answered questions. The parents or caregiver and the student should see their provider to assess the child's headache, migraine, and advise upon the pediatric migraine action plan. So once the provider and the parents or caregiver and the student agree upon a plan, that is then implemented to the school nurse. When a student comes to the school nurse with a complaint of a headache or a migraine, the nurse can then provide the plan of care as established and support that student in getting better. If the headache or migraine were to occur in school again, everyone can be reassured there's an individualized plan of action for this patient with their pediatric migraine action plan in place. There are 3 main sections on the front page of the pediatric migraine action plan. There's the area at the top with the demographic information, such as the date it was devised or revised, the child's name, date of birth, treating provider and their phone number in case they need to be contacted, the emergency contact and phone number, usually the parent, caregiver, or person in charge of that patient's well-being, and then the headache information, listing their headache type, if ARA, what their symptoms are, if they have migraine without headache, all of those things that are applicable to that personal child's experience. The PED map is divided into 3 colors, also called zones. So it looks similar to a stoplight. Its green section is the prevention, except it's upside down. The green section is the prevention zone. So this is what we want to do to try and prevent headaches from occurring. So any actions that need to be taken on the school's part to allow that child to have improved headache hygiene is going to be illustrated in this area. The yellow section is the treatment zone. This is the area where we talk about what the nurse should do, or what the student should do, or what the teacher should do in the instance that the child starts to complain of a headache. And then the red is the help zone. This is the emergency zone. This is when things are not normal. When do you call 911? When do you call the parent for an emergency? All of those things are included in the red zone. The bottom of the PED map is for the provider and the parent or guardian to sign, authorizing the plan in the yellow zone. Okay, so that applies to the yellow zone. It gives permissions to the nurse. It's the contract portion. The back side of the PED map is the headache toolbox. This toolbox involves lots of strategies that are being utilized by the family, the child, and should be implemented in the school as well in order to manage their migraine in an everyday, providing tools for life, home, and school. So there are specific tools that are recommended that can be translated into a 504 plan for the school. And the PED map has a very convenient checkbox method of illustrating those needs so that they can personalize it again to your child. The back side of the PED map is the headache toolbox, like I said. It contains strategies, tools for life, tools for home, tools for school. These tools are what we use to illustrate how you can help yourself get better, how they can help you get better, and all these boxes can be checked off in the areas that are specific to the child and their particular needs. So here's an illustration of what it actually looks like. And so I don't know how clearly the color is going to come up on your screen, but you can see that the green apple represents the green zone. The yellow is the hazard or warning zone, and then the red is the emergency when to call section. And then in the back, that's your toolbox that gives you lots of information on steps to be taken to help manage the child in different settings. And you can see the check boxes are where we illustrate the personalized care and requests to be implemented in a 504 plan for your child in reference to their migraines. This is a larger view of the top part of the demographic area, a larger view of the green section, the green zone, as we talked about, all of these headache hygiene measures that are most important and that you're working on at home that can be continued to be emphasized by the school. The yellow zone, this is what the nurse is really looking for in the event that your child becomes symptomatic and needs treatment. It gives them something to go to quickly, something accessible, something that's signed by you and implemented more like a contract between you and the provider. So that is a safer way to record and keep information on the child. Also the 911 or the emergency section, it could be a range of emergencies. Time to call the provider's office, time to go to the emergency room, when or if symptoms are above and beyond that of a migraine, and when things become an emergency. The signatures at the bottom section are where it becomes a contract, as we had said. And then the action plan on the back is your toolbox for the migraine action plan. There's lots of great resources too, and it's good for the parent and the nurse to be on the same page and have the same knowledge. So looking at these resources as helpful are great tools as well. And then finally, your checkbox for those accommodations that may need to be made. So who will the PED map benefit? This is meant to benefit the parent, the child, and definitely the provider who is hoping that there is a seamless approach to management of migraine across the community. The school nurse can have a personalized plan of action for each child that they interact with, which makes their job a lot easier. Mostly important, the child or adolescent is the one to benefit. It decreases disruption to their education, prevents their migraines from being chronic. It provides accommodations for special services in order to keep them going and not let them miss. Decreases their anxiety because they know they have a plan in place, which is really important. Empowering them to do their best and be their best advocate. When you give them support through something like a contract, they feel validated, they feel confidence, they feel important, and that you are important, that they are important to you. These are some references. Myself and Scott Turner, Elizabeth Rendy, and many other people in the headache world were happy to partake in putting this together. You can see Dr. Spurka's name for those of you that follow Dr. Spurka at CHOP. And it was a group effort from many headache providers across the country to really get it right and have a uniform approach. I hope you've enjoyed this. As I said, we'll be happy to provide samples of this and hope that they can benefit you if you aren't already using them with the provider that you are currently seeing. I'll see you soon for the newest migraine medication lecture.